623 new this morning. Fentanyl continues to devastate communities across Indiana. The CDCP reports in Indiana the numbers hit a record high for a second year in a row. An estimated 2,750 Hoosiers died of drug overdoses. This morning, the numbers, what is saving lives, and one mother's crusade to save others after losing her son to the drug epidemic.
He fought it every single day, and the medicine hijacked his brain.
Cammie Wolf-Rice, who grew up in the south side of Indy, knows the reality of drug addiction all too well. She lost her son Christopher to the drug epidemic and now dedicates her life to ending these tragedies. She says stopping the addiction before it happens is the only way, and it all too often starts with a prescription.
He went home from the first major surgery with 90 Oxycontins, and I was told to give them to him every 4 hours. So I was feeding them to him, and then he got 90 more. And 80% of heroin users started with a prescription, and Christopher was one of those.
When opioid addicts can no longer get their high through prescription, they turn to street drugs, now more than ever spiked with deadly fentanyl.
More often than not is, it's parents finding kids or friends finding other friends and things like that. And a lot of times they don't know what to do.
EMTs with the Bargersville Fire Department say they often visit homes several times to save the same overdose patient. If too much time passes before they're found, they'll die. But a free, easy-to-get drug called Narcan can save an overdose patient's life.
I believe everyone should own Narcan. It should be in every household.
And if not, first responders say that could be finding an addicted loved one who's run out of time. So I want to show you what Narcan is, and as you heard Cammie say there, it keeps the addict's lungs breathing in an overdose situation. That is so important. These kits are very easy. I am afraid of needles, so when I first heard, I thought, gosh, I would be so afraid. This is just something that you shoot right up the nose of a patient. It is not a needle. It just goes right in the nose. The chemical gets into their blood system as fast as it possibly can. There are also this other part of this problem is fentanyl. Unless you are getting your drugs from a doctor, you have no idea if this fentanyl that can kill you like that is in your drugs. They now have testing strips that you can get if you are in some way still needing to test that. Now, Cammie has a new book. It's called The Flight, and that is out helping drug patients learn how to get unaddicted to drugs. She's also working with hospitals to get patient care techs in every hospital to help patients with pain management, because you heard her say she thinks that is like the key thing is when you go into a hospital and you come out with all these opioids, then you become addicted. Not necessarily everyone, of course.
Yeah, it's no longer the drug dealer on the corner. Now it's watching when you're prescribed medication that you don't become addicted to these opioids.
I was told something similar when I had dental surgery because of the way that they were prescribing my prescription was different than they had before, and they mentioned that that was just a result of the opioid
Dentists
epidemic,
are some of the highest prescribing opioid, not dealers, but people out there right now.
Because, not intentionally.
Yes, not intentionally. So I'm going to have so much more where you can get these and have them in your household if you need them. They are free. And again, maybe it's not your child, but maybe it's someone, maybe you don't even know them.
Very valuable information there. Thanks so much.